Hello, my name is Szanto. I am 74 years old and have been an MDS patient for 15 years. I hope to convey to you my experiences with MDS. I also hope my longevity with MDS will give you hope and encouragement as you live with MDS. During a routine wellness check, I was diagnosed with anemia in July 1996. I was a very active outdoor person, and I did not feel there was anything wrong with me, so I did nothing about it. The next year, during another routine wellness check, the doctor wrote in red pen and circled significant anemia. He recommended I see my primary care doctor. I saw him on August 1997 and had blood tests run over a 5-week period. I was told they didn't know what was wrong with me. My doctor recommended I see a hematologist-oncologist, which I did. A bone marrow biopsy was performed, and it was determined my anemia was due to MDS. The doctor had me come in once a week for a CBC for the next 15 months, and in January 1999, I started on Procreate injections, 30,000 units once a week. During the next 5 years and 9 months, the Procreate injections increased gradually from 30,000 to 80,000 units to keep my hemoglobin at healthy levels. In December 2005, I was switched from weekly Procreate to biweekly Aranesp injections. This was a blessing. The Aranesp dosage started at 300 mcg for 28 injections and now continues at 400 mcg. I have had a total of 176 Aranesp injections as of October 2012. Back in June 2001, I started on blood transfusions. As of October 2012, I have received 377 units of blood. By June 2004, I was in iron overload. My ferritin was 2,900 due to the number of blood transfusions, so I started iron chelation with a drug called Desferol, which is dispensed with an infusion pump for 12 hours a day, 5 days a week. I continued this treatment for 1.5 years. In the fall of 2005, the MDS Foundation notified me that there was a new oral drug, Xjade, used to treat iron overload. Xjade was up for FDA approval in Washington, D.C., and I was asked to testify as to why the drug should be approved. I was thrilled to go. It would be wonderful to get off that pump. I went with 14 other patients who also developed iron overload as a result of chronic transfusions for MDS, sickle cell anemia, and thalassemia. Thankfully, it was approved. I started taking Xjade 1,500 milligrams daily in January of 2006. Hooray! This was another blessing. Every morning I dissolve the Xjade tablets in water and drink it. I've been on Xjade ever since, except for 6 months when the ferritin level went to 312, low enough for me to come off. The dosage has varied over the last 7 years. I am currently taking 1,000 milligrams a day. In September 2004, Dr. Alan List of the Moffitt Cancer Research Center stopped the Procreate injection so my system would be clean to start the CC 5013 Revlimid drug trial. My diagnosis was MDS subtype refractory anemia with ring sideroblast, or RARS, R-A-R-S. The drug did not work for me. It did work for patients with 5q minus chromosome malfunction. Results from these patients were amazing. Most of the patients with 5q minus had a significant reduction in their transfusion needs. Some no longer needed transfusions at all. Halfway through the trial, I had a sense it wasn't working for me, but I went ahead and completed the trial because I knew the research collected from me might benefit other MDS patients later on. During these past 15 years, I have had 7 bone marrow biopsies. MDS is classified as high or low risk. I am in the low risk category, and my biopsies have not changed during these 15 years. During my first 3 years, I could not find any non-MDS specialist who knew anything about the disease. Also, during this time, there wasn't much or any research on MDS. The first research that took place was for high-risk patients. I totally agree with this because they are at greater risk to come down with leukemia. There is now research taking place for high and low risk patients. The good news is there is 100 plus MDS research centers worldwide. When I was first diagnosed with anemia and then with MDS, I was in denial. This went on for 1.5 years. As time went on, I realized not many people knew about this disease, so I decided to find out all I could. And I began to keep detailed records of what was going on. I knew my body was the temple of the Lord, and I had a responsibility to take care of it. This is when my denial shifted to a positive attitude. I started by reading everything I could, looking up on the internet, talking to my doctor, and attending the MDS patient forums put on by the MDS Foundation. In fact, I continue to try to attend 1 or 2 a year. These forums have been very educational. We hear from doctors and nurses in the field and from patients who share their experiences, ask and discuss questions. I have also done several videos for the drug manufacturer of Xjade. This involvement has caused me to realize how much I appreciated what was taking place to find better ways to deal with iron overload. I joined Data for National MDS Register in June 2008. This is a register that collects detailed information on MDS patients nationwide. Their goal is to help MDS patients by determining what the similarities and differences are in patients, what works and what doesn't work. Besides learning all I can about MDS from multiple avenues and getting involved, I've also used my faith to pray for and encourage other patients. Each time I get out of my vehicle to enter the oncology center or infusion center, I pray the Lord will put someone in my path that He wants me to speak to, encourage, or pray for. He honors this request each time. I also thank the nurses who attend to me, and if they need prayer, I pray with them. When I go to the blood bank, I introduce myself to the donors and thank them for keeping me alive. I believe this involvement is what is keeping me going. My positive attitude and faith has been strengthened every day. To summarize, I would say learn all you can about MDS. Stay up to date on the research. Stay positive. Be motivated. And get involved, especially in patient forums. Ask questions of your doctor and nurses, and most of all, keep God as your pilot. Yes, it is true, I have not been healed physically, but God has healed me spiritually, and my spirit is what will live on for eternity. I thank the MDS Foundation for allowing me to share this time with you. May God bless you now and forever.